At the most important practical topic of final year, which is history taking. Okay, at first the we starts from the patient particulars. Okay, we're going to the step by step, but at first the patient particulars. In the patient particulars, we have to mention the name, age, sex, religion, occupation, address, date of admission, and date of examination. After that, what is the significance of these patient particulars? Okay, at first see the name. Okay, so name is for the identification of this person or the patient. Okay, then the age is important because certain group of disease is prominent in certain age. As in old age, we can see the more prominent the heart diseases, pulmonary diseases, osteoarthritis, Alzheimer's disease. These are the old age group disease, and in the young age we find the chicken pox, etc. Okay? So age is important. Then the sex is also the few disease is prominent in male and few disease in female. Okay, like the menstruation related problems are found in the female, that's male we don't found such cases. Okay, then the religion is also important because the certain group of disease is prominent in certain religion because of their dresses, their habits. Okay, as for example, the vitamin D deficiency is prominent in the Muslim females. Okay, because of their dress. After that, the occupation, it is important because the occupational disease. If a worker works in the factory and she might have silicosis. Okay, so this is important for the occupational diseases. We have to mention the occupation. Then the address is also important because certain group of disease is prominent in certain areas. For example, Kalazar is prominent in Jharkhand, Bihar, etc. Okay, so this is why address is important. After that, the date of admission with date and time, and date of examination with date and time. Okay, this is goes to the patient particulars. After that, we are going to the history proper. Okay, in history proper, at first we have to write that chief complaints are the 1 or 2, maximum 3. Okay, with proper duration. Okay, for example, at first we start here from the CVS. Okay, suppose it is a case of mitral stenosis. Okay, so in the mitral stenosis, what is the chief complaints? Chief complaints mean the shortness of breath. Okay, so the shortness of breath for last 10 months. Second chief complaint is cough with hemoptysis for last 1 month. Okay, so cough with hemoptysis from last 1 month. Okay, so this is the chief complaint. This 1 or 2 chief complaints is this complaint, which complaint the patient was admitted in the hospital. Okay, after that, the history of present illness. So in the history of present illness, you have to elaborate the chief complaints. Okay, so what you have to write in the present illness? At first, the patient was apparently well before how much time? Okay, so here the patient is apparently well 10 months ago. Okay, and then presented with gradually increasing breathlessness for last 10 months, cough with hemoptysis for last 1 month. Okay, after that, you have to elaborate the shortness of breath. The short breathlessness was gradually progressive, exertional, non-seasonal, and NIHA grade 2 in severity. Okay, after that, you have to elaborate the cough. Cough is not associated with fever, as the patient is not very much told about cough. Okay, after that, the other history, like the patient complained of occasional palpitation with mild exertion. About 2 weeks back, the patient experienced shortness of breath at night. Probably acute, it is a case of acute respiratory distress due to paroxysmal nocturnal dyspnea. Okay, then you have to write the negative histories, like she has no history of chest pain, no swelling of legs, no history of syncope, nausea, vomiting, no history of hypertension and diabetes, had uneventful history of childbirth, and one major history which is significant here, that he gave a definite history of fever in childhood affecting the joints and the sore throat. Okay, so after the present illness, you have to write the past history. In the past history, she gave a definite history of rheumatic fever in her childhood, which affected mainly the big joints like knee, ankle, elbow, following an attack of sore throat, and she took injection of benzathine penicillin for few years but suddenly stopped, and she has no such significant surgical history. At the past history, you have to write the family history. In the family history, you have to write that the same types of symptoms or other types of symptoms or this type of disease was present previously in his family, in his or her family or not, her or his father or mother, okay, or in his children. So this type of family history you have to take. And in this patient, there is no such significant history found. No such significant family history is found, okay. After that, the personal history. It is important. In the personal history, you have to mention the marital status, he or she is married or not, education, addiction, okay. Addiction, it is very important. In the addiction point, you have to write which type of addiction he or she was taking. If he has a smoker, then how much or how many cigarettes he is smoking in a day, okay. And if he has alcohol user, then how much and which type of alcohol he is taking in a day, okay. You have to mention in the addiction part. Then the sleep, bowel, bladder and urine and appetite, you have to ask the patient and write as the patient told you. After that, the menstrual history, if she is a female patient, or you have no such menstrual history if he is a male patient, okay. After that, the treatment history. Here you can see the treatment history is injection benzathine penicillin for few years but stopped, and no such allergic history, okay. You have to mention the allergic history also. So that's all about the history paper. Then in the next video, we discuss about the general survey.